Hi everyone, welcome back to Nurse Katherine here. In today's video, we are going to be talking about patient prioritization. This can be incredibly challenging when trying to figure this out on the floor, especially as a new grad or even as a nurse. Sometimes I struggle with prioritizing my patients and who I need to see first and who I can see last. The NCLEX exam also has a lot of questions about patient prioritization and who you are going to see first. So I'm going to be talking about that in today's video and giving you tips and helping you understand who you are going to see first. So let's get started. First, you always follow your ABCs. That is something that is never changing when it comes to patient prioritization. And I recently just went to an NCLEX website to make sure this is still the same as it was back in 2016 when I took my NCLEX, and of course, yes, it is. NCLEX is saying focus on those ABCs first, your airway, breathing, and circulation patients. And then after that point, after you have all of those patients figured out and you have ranked those patients, that's when you can go onto your Maslow's hierarchy of needs. Some of you may be like, what in the world is the Maslow's hierarchy of needs? I promise you will get there in nursing school eventually. If you are new to nursing, or even if you're a nurse now and you're like, wait, what is Maslow's hierarchy of needs? Because I forgot those actually. I couldn't remember the steps. So here it is. Here is the Maslow's hierarchy of needs. You start at the bottom, and that is who you will start with first. Now, I can say this can be incredibly, like I said, challenging to figure out who you need to see first. When you are a new grad, when you're a nurse, when you're in nursing school, and your preceptor, if you are in nursing school, should be teaching you how to prioritize your patients. Remember, always go to your ABCs. When you're taking that NCLEX exam, always go to your ABCs, then think about the Maslow's hierarchy of needs. Now, there have been situations in the ER, this was a horrendous day, I will say. This was probably one of the most awful days I've had in the ER, that I had a terrible section. We were short-staffed, I was overworked, and I had a patient fall out of bed, and it was awful. But there were also patients coming in from the ambulance to my other section that I needed to tend to as well, and one of them being chest pain. Now, those are the kind of situations you are going to run into when you are a nurse, and you have to think on the spot, and you have to think, oh my gosh, who do I need to see first? This person who just fell, or this person coming in with chest pain, and are they having a heart attack? Now, the person with chest pain, they fortunately were not having a heart attack, but I had to stay with the patient who was on the ground because they were then bleeding. It was a fall with injury. Every nurse's worst disaster that could ever happen is a fall with injury because of all the paperwork you have to do, and of course because of the patient is now injured on your watch. So that's a time when I had to rank who the most important patient was. Now, when taking NCLEX, they can really be tricky when it comes to patient prioritization questions, but you always just remember have to think ABCs. That's what I want you to just remember in your head when you are taking your NCLEX exam or when you're on the floor is ABCs. Yes, somebody might have to go to the bathroom really bad and might have to pee their pants or pee the bed, but the patient having shortness of breath always comes first before the patient who has to go to the bathroom. Even if you think it's going to be a short trip to the bathroom, I've done that before, and sometimes it just doesn't end up being a short trip to the bathroom, or you can't leave them in the bathroom alone because then they start complaining of dizziness. And then you have this other patient over here who's having shortness of breath, and this patient over here who is gonna pee the bed, and that's the world of nursing for you. That is bedside nursing right there. So yes, always remember your ABCs and your hierarchy of needs, and that is how you prioritize your patients. And yes, I know it is much easier said than done. All right, that is it for today's video. Thank you for tuning in. Don't forget to subscribe and like this video. Please hit that notification bell for more videos coming out like this every single day, pretty much. All right, I'll see you in tomorrow's video.